Well, health ministers from across the country are in Calgary for the next few days for a series of meetings. Federal Health Minister Marjorie Michel joining us this morning. Minister, thanks so much for your time. I know it's a busy couple days. And I guess if we can just start with some of the key issues that you'll be looking to address in these meetings.
Well, as you know, we will have to talk together uh, on some key issue like, access to care. So, as you know, all provinces and territories are looking to get more health professional into their system. So, we will see international doctors and nurses, how we can bring more in the system. Also, we will talk about labor mobility across provinces, and we will also talk maybe on how we can improve on regulation, how we can remove all administrative burden that are in the system. I am looking to have conversation with my counterparts to support them in the work they are doing. I know some of them would like to talk about pharmacare, for example, so we will have conversation about this. As you know, I didn't commit to move now on this, but I'm still continuing the conversation. The Prime Minister said that we have a pharmacare agreement, with some provinces, and we have an offer, but not all provinces are would like to get the same pharmacare, but we will continue conversation with all of them.
And so, Minister, I mean, Alberta's Health Minister, Minister LaGrange, has recently said that Alberta continues to not want to sign on to that pharmacare plan and thinks that a fine job is being done here in province. Do you have some flexibility then? Am I hearing from you that there will be flexibility around whether or not we sign on to this program and will be able to continue to get federal funding?
So let me tell you, I'm going to this meeting with my mind open. I want to work with provinces and to be collaborative. They are the one working on the ground. We have some realities that we have to face, all of us. But I'm willing to work with all the provinces and territories to see how the federal government can better support them to deliver health care for Canadians.
Okay. Youth, mental health, addiction, those continue to be major concerns across the country. You do have an announcement later this morning. What can you tell us about that, and how much will those issues play into discussions over the next few days?
I would tell you that, I did a tour during the summer and I came back with the top topic was youth mental health everywhere. So I'm very happy that we are going to announce, I don't know if you know about youth integrated services. It's some hubs that we already have across the country. We'll have a good announcement today. And I would say I just need to say that this model come from research that CIHR did a few years ago that shows that this model will help youth with a single door coming in and get all the services. And I think we need to have a focus on youth. And yes, it will be one of my top conversation with the health ministers and the mental health ministers at the meeting, because it's really concerning mental health and also addiction and what we can do to improve this situation.
Okay, we'll look forward to the details of that announcement later this morning. Again, Minister, thank you so much for your time on what is a very busy couple of days for you. We do appreciate it. That is Federal Health Minister Marjorie Michel.
Thank you to you. Have
Thanks.
a nice day.
You too.